In multiple sclerosis, does race affect prognosis? Well, in this shocking and upsetting observational study, black people with MS compared to white people were about 5 times more likely to have moderate or worse disability. Is this finding real? And if so, why does it occur and what can be done about it? Now, the association between race and MS has been reported before. For instance, this study done in Southern California, United States, where I am, showed that black people seem to have a slightly increased risk of getting multiple sclerosis. If you look on the left, this is the total risk. In the middle is females, and on the right is males. And compared to white people, black people have a slightly increased risk. Hispanic people have a somewhat decreased risk, and Asian people have a dramatically reduced risk of MS, which has been reported previously. Now, there aren't huge differences, but one thing I'll point out is one of the authors on the study had some reservation about publishing because it could be potentially offensive. After all, this is a non-modifiable risk factor. You can't do anything about your race. You can quit smoking, you can eat a healthier diet, you can exercise, but you can't change your race. However, I object to that way of thinking for 2 reasons. One is, in my opinion, it's highly unlikely this phenomenon is genetic. The reason I say that is there are many African countries where the risk of MS is exceedingly low. It's almost unheard of. Secondly, race is not the same as ethnicity, and some people who are black may actually be well over 50% European genetically. So I think it's unlikely this is a genetic phenomenon. Now, Asian people, even if they were born in the United States, even if they have other risk factors for vascular diseases, seem to have lower rates of MS. That may be genetic, but the black-white difference is likely not genetic in my opinion. And in fact, historically, MS was thought to be more of a European disease. I think there's something else going on. There may be some environmental, cultural, medical factors, and maybe there's something that we can actually do about it. Furthermore, this actually may be actionable information. If black people really did have a worse prognosis, now this is sort of natural history prognosis, this is a publication from 2013, a lot of these people were untreated or on lower efficacy medications, it could actually change your decision making, so it's important to have this information in my opinion. So the study we're looking at is an observational study of 500 people with MS done at a single center, the University of Alabama Birmingham Comprehensive MS Center, and it took place between 2013 and 2022. That's the date range they looked at. And unlike where I practice in Southern California, where there's a wide range of ethnicities, it was pretty much just white and black people with MS, 39.2% black and 60.8% white. So is there a difference in the prognosis between these two races? The outcomes they looked at are the EDSS, Expanded Disability Status Scale. This is a measure of disability in MS research, and they also looked at ambulatory assistance, like do you need a cane or walker or wheelchair to get around. Now, of course, white and black people are different in a lot of ways, so they corrected for potential confounders, such as age, sex, body mass index, type of multiple sclerosis, duration of the disease, medical comorbidities like hypertension and diabetes, smoking, and also income and health insurance to see if you can take out all those other factors. Though this is not a randomized controlled trial, an observational study correcting for confounders is not the same, and as you'll see, you can get some strange outcomes. Anyway, here are the data. On the left, you see everyone in the study. In the middle, white people with MS, and on the right, black people with MS. So most of the people in the study were women, 73% of white people and 75.5% of black people, which makes sense. Most people with MS are women. The age of symptom onset was a little older in white people, 35.9 versus 31.6 in black people. This was statistically significant, p less than 0.001. The average age of diagnosis was 38, much older in white people versus 33.3 in black people. Now, you may be wondering, maybe people perceive MS to be a white person disease. Black people are underdiagnosed. It takes longer to diagnose them from symptom onset. They did not find that. Average time to diagnosis, 2 years in white people versus 1.7 years in black people, roughly the same. Average time to start a treatment, 3.3 years from symptom onset in white people versus 2.8 years, a little bit faster, not a statistically significant difference in black people. So there's not an obvious delay in treatment, at least in this study. And average time from diagnosis to starting treatment, 1.4 years in white people, a little bit shorter in black people, 1.1 years. Now, the authors point out that black people in this study were much more likely to be hospitalized at the time of diagnosis, like they had a more severe relapse or attack leading to diagnosis, suggesting maybe there were some subtle, milder attacks not recognized as symptom onset by the physicians or even the individuals with the disease. And perhaps black people were underdiagnosed in that sense because they were sort of worse off at disease onset. It took a more severe attack to lead to a diagnosis. However, if you look at the actual rate of relapses, it was 1 attack in the first year on average in white people versus only 0.15 in black people. So black people had dramatically fewer attacks, though perhaps they were more severe, leading to hospitalization, 70% in black people versus 30% in white people at the time of diagnosis. This is very unexpected and not really consistent with my experience, the dramatically increased risk of relapses in white people in the first year compared to black people. So let's continue. Is the worst prognosis in black people with MS due to the fact that more black people get progressive MS? This has been reported in prior studies. But this study found the opposite. Only 10.2% of black people with MS had progressive MS, 89.8% had relapsing MS, whereas white people, 19.8% had progressive MS, almost double the rate as in black people. So the authors argue we found that black people just have more aggressive relapsing MS for whatever reason. Prior epidemiologic studies suggest that it's actually progressive MS that's driving most of the long-term disability in people with MS. They looked at the average disease duration, and despite being diagnosed younger on average, they actually had a shorter disease duration, 9.8 years on average in the study versus 12.5 years for white people, just because the average white person was a little bit older in this study. And as I mentioned, hospitalization with the first attack was much greater, 69.3%, around 70%, versus around 30% of white people. Now let's look at the key finding of the study, disability. So they looked at the EDSS, Expanded Disability Status Scale, and they broke it up into different categories. 0 to 3.5 would be considered milder disability. 4 to 5.5 would involve usually some degree of walking impairment. I won't go into the details of the scoring of the EDSS, separate video on this topic if you're interested in the notes below, but some degree of walking impairment, particularly walking long distances. EDSS of 6 means a cane is required to walk 100 meters, and so this last category is 6 or greater, meaning some assistance is required for walking long distances. Now again, in the middle is white people, on the right is black people. I created this box to indicate people with moderate or greater disability, EDSS of 4 or greater. And this top column is at the beginning of the study, at the time of diagnosis. And black people had more disability, 31.6% with moderate or greater disability versus only 18.4% of white people with multiple sclerosis. What about the end of the study? This is the last EDSS. So black people, 62.7% had moderate or greater disability versus only 38.5% of white people with MS, which was highly statistically significant, p-value of less than 0.001. Now you may say that is a difference, that's about 60% greater risk in black people, but at the beginning of the video you said there was a 5 times greater risk. What is happening here? What's happening is the 5 times greater risk that's mentioned in the abstract of the study is due to correction for confounders. What the numbers are saying is that black people are a little bit younger in this study. They're less likely to have progressive MS. They should have less disability, but they actually have more disability. So essentially, the algorithm is overcorrecting for these confounders. And in my opinion, we should just throw it out. It really doesn't mean anything. Of course, it would be impossible to have a 5 times greater risk than 38.5% risk of moderate disability. This would be like over 150%. But you could say there is a significantly, not just statistically, but also clinically significantly greater risk in black people with MS. We have to take it seriously. That's what the data show. Now, is this due to just more spinal cord injury in black people with MS? Well, maybe. They looked at transverse myelitis, inflammation of the spinal cord, which was present in 41.8% of black people versus only 31.6% of white people, statistically significant at 0.019. They also looked at vision loss at disease onset, which was more common in black people, 38.3% versus 28.6% of white people. And actually, optic neuritis is associated with better prognosis in multiple sclerosis on the average based on other studies. Let's look at some more data. This is what type of ambulatory assistance people needed at the time of diagnosis, and it does favor white people. So 75.3% of white people required no assistance, didn't need a cane or anything like that, versus only 63.8% of black people. 11.2% of black people needed a cane versus slightly fewer, 10.2% of white people. 10.2% of black people needed a walker versus 5.9% of white people. And 14.8% of black people needed a wheelchair at the time of diagnosis versus only 8.6% of white people. Keep in mind, people could have been in the midst of a relapse during this evaluation. What about insurance? I know a lot of people who watch these videos maybe outside of the United States. Keep in mind that there are pretty significant wealth differences between black people and white people in the United States, thought to be due to the history of slavery and discrimination. And so people in other countries may not be as familiar with that. But these researchers did not find that. The type of insurance people had was roughly the same. Now, maybe white people had a slightly higher rate of private insurance, 54.6% of white people versus 51% of black people, but a trivial and not statistically significant difference. So that didn't seem to be driving this. What about overall wealth? Maybe black people were just more disenfranchised. Now, they didn't really know people's wealth or income. They just used zip code, which is associated with income. Now, of course, on an individual basis, it's not highly associated with income, but from a population perspective, there's a pretty good correlation. And the white people were much wealthier. So these zip codes 2, 3, and greater than 3 refer to different classifications of zip code based on average income. And for instance, classification 2, which was a lower income class of zip codes, included 58.2% of black people versus 26.3% of white people. And the higher income classes of zip code greater than 3 was 18.4% of black people versus 35.5% of white people. So there's a pretty significant wealth gap there that could be influencing our outcome. What about comorbidities, other medical conditions? There's evidence in other research that even though general medical conditions aren't strongly linked to risk of MS, they are associated to some extent with prognosis of MS. So high blood pressure, hypertension, was a little more common in black people, 49% of black people versus 42.4% of white people. Diabetes, a little more common in black people, 15.8% versus 10.5% of white people. Smoking was actually more common in white people, 32.6% versus 26% of black people. The average BMI was higher in black people, 32.6 versus 29.6 in white people. So more obesity in black people. What about medication? Maybe black people are being undertreated. They're not getting the stronger medications. Well, the percentage of people getting the higher efficacy disease-modifying therapies, such as Tysabri, Ocrevus, and Kesimpta, was actually a little bit higher at the time of diagnosis in black people, 18.9% versus 16.8% of white people. Now, that may seem like a low percentage. More and more higher efficacy disease-modifying therapies are being used, but keep in mind this study started in 2013 and the culture has definitely changed. At the time of evaluating the medical record, the time of capture, the percentage using higher efficacy drugs was about 49% in both groups. So it doesn't seem like black people are getting inferior drugs, though you could argue, given they have more aggressive MS, more aggressive relapsing MS, they may be undertreated a little bit relative to their presentation. So what predicted worse disability? Here they looked at predictors of EDSS greater or equal to 4, moderate or greater disability. On the left we see black people with MS, on the right white people with MS, and you can see age was slightly associated with disability. Older people are more likely to be disabled. In comorbidities, they didn't find anything that was statistically significant, but people with both high blood pressure and diabetes were more likely, roughly 2 to 3-fold more likely to have moderate or worse disability. And for black people, the p-value wasn't quite statistically significant. It was p equals 0.058, but there's a strong trend there. Income seemed to make a difference for black people, but not for white people. For this zip code coded 2, this is lower income areas, black people were about 3-fold more likely to have moderate or worse disability, which was statistically significant, but for poor white people, it didn't seem to make any clear difference whatsoever. For insurance, there was a huge effect. People with private insurance, this is health insurance, they were dramatically less likely to be disabled. A odds ratio of 0.17 for black people and 0.21 for white people. This is a roughly 80% reduction in the risk of moderate or worse disability, though I suspect this is due to reverse causation. People with more aggressive MS who become disabled lose their jobs and they lose their private health insurance. I'm a medical doctor for a private health insurance company, but I know that I'm not 80% effective in reducing disability in multiple sclerosis. That's probably not practical for a doctor to achieve, even with the best resources. So again, I think this is at least partly reverse causation. So why is there this black-white difference? Black people, at least based on this study, do seem to have, on average, a slightly increased chance of more disability with multiple sclerosis. Of course, there's a huge individual variation. I have many black patients with MS. Many of them are doing quite well, though others are not doing as well. I wouldn't have necessarily noticed a large black-white difference in my own patients, though it's hard to notice these things as a doctor because there's so much individual variation. I do have some data on some of my patients with MS, and I may look through that and publish it at a later time to see if I have a black-white difference in prognosis in my own patients and what might be driving that effect. So what explains this difference? Well, one thing may be just the statistical phenomenon I described earlier, just overcorrection for confounders. I don't really believe the top-line results of this study that there's a dramatically greater risk of disability in black people with MS. I think that's just a statistical phenomenon, but I do believe the raw results. I do believe the general finding of the study that they did have more disability in black people with MS. One possibility may be sort of underdiagnosis and treatment. The fact that black people were hospitalized 70% of the time of diagnosis, it seems very likely to me that there's some earlier, milder symptoms that are being missed, because often first MS attacks aren't that severe. Someone has optic neuritis, the vision in their affected eye is 20/40. They see an optometrist and are referred to an ophthalmologist who eventually diagnoses them with MS. Or they have a sensory symptom like numbness in the right face. Most people are not hospitalized with MS relapses in modern times, so I do think that rate seems very high, and people have to be aware of the fact that black people do not have a decreased risk of multiple sclerosis. That's old school thinking. Newer evidence clearly refutes that, and doctors have to be aware of the possibility of MS, particularly in a young to middle-aged person with a subacute onset neurological symptom. Another thing is treatment. You can see that at the beginning of this study, black people had a less than 20% rate of getting highly effective treatments. Now, I'm not trying to hate on the doctors at this medical center. Again, this study started in 2013. The culture has changed a lot, but we should recognize that there's increasing evidence that stronger medications, despite the greater risk of serious side effects, do seem to be more effective and are probably warranted in many of these people with multiple sclerosis, both black and white, and certainly a young black person with aggressive relapsing MS that leads to hospitalization should at least consider high efficacy disease-modifying therapy. The other thing is comorbidities. Black people are a little bit less healthy overall, and that may be driving a difference in prognosis. So just trying to reduce the rates of obesity, hypertension, diabetes, high cholesterol, etc., that may go a long way. And of course, the last thing is health insurance, making sure everyone has adequate health insurance so they can get diagnosed promptly and get adequate treatment. Now, even though I expressed a lot of skepticism of the idea that private health insurance is that beneficial, certainly I don't think it's 80% beneficial, but maybe it has some benefit. They didn't really do a detailed analysis on differences in treatment in people with different forms of insurance in this particular study. It'd be interesting to look at. But I'd be interested to know your own experiences, particularly if you're black and have multiple sclerosis. Was there any delay in diagnosis or treatment? Did you have any barriers in terms of seeing doctors or with health insurance or otherwise? And if you're comfortable sharing, how have you done over time with the disease? And I'd be interested to know, do you consider this video to be offensive, or do you think it's worth talking about? And let me know if you have ideas for other topics.